It came on very, very suddenly that I had severe sciatic pain.
Even with all the scans, MRI, CT scans that we might order and look at, the most important information is what the patient tells us.
I was in so much pain and I just couldn't do anything hardly. I could barely even walk.
If you listen to the patients, you know what they're looking for, what their expectations are, and you can provide better patient care that way.
We also have to take the time to explain, and in doing so, we get on the same page and therefore can make the best decision together with the patient of how to eliminate the problem. We have to use every resource that we have. We have to use models, diagrams, pictures. Sometimes we even refer to the web for different educational materials. All of that is very important for the patient to know, to understand, to internalize, and therefore make the best decision for themselves, again, with the help of the surgeon.
The man says he's going to have you better and you will walk out of the hospital the day after the surgery. And probably 2 days later, I was on the table and the surgery was robotic and I only have like 2 little 1-inch scars.
The minimally invasive approaches that can be done and performed during surgery, where patients were previously staying in the hospital for several days at a time. Typically a patient goes home the next day after a significant spine surgery, and it just makes a huge difference in their overall recovery.
Only a surgeon who has interest in emerging technology will actually be on the forward leading edge. So it's very important that emerging technology is at the core of a surgeon's interest. A team is very important for the patient to have the best result. We can provide the patient with a much bigger resource and a much bigger scope of expertise to give them the care that they need to hopefully eliminate the problems that they might have.
I was in excruciating pain. The first one night I met was his nurse, Jackie Bryant, and she was just couldn't do more to make me comfortable as compassionately as she could.
Melissa came in and explained how well everything went, and she just explained it so thorough, and if you had any questions, she took time to answer them, and you could tell she knew what she was talking about too.
Confident, sure, calm. It's like, we're going to make you better, it's going to be fine.
I could just get out and play with my grandchildren and have fun with them where I couldn't before. All I could do was sit down.
I walked out of the hospital the next day, and I've been fine, knock wood, ever since. I'm back to playing golf and riding my bike, and maybe I'll kayak again.